The first category of drugs we're going to talk about are antihistamines. Antihistamines can be broken down into first and second generation. The reason is that the first generation tends to cross the blood-brain barrier a little bit easier than the second generation. And so when we look at the first generation antihistamines, diphenhydramine, or a common branded name is Benadryl, is found worldwide. When we look at and what I've done for you within this particular slide set is that I've tried to indicate which of these medications are on the national formulary for India, because then these would be the medicines that are probably easier accessible to patients throughout India. And so some of the other first generation antihistamines that we have available is chlorpheniramine and phentermine, both of which are a part of the national formulary of India. You can see that these products can come in various dosage forms. So for example, the diphenhydramine can come as a capsule, elixir, injectable, and IV. And it has multiple types of uses, but we're mostly going to focus on the respiratory uses for these particular agents. We also have other products kind of worldwide that are kind of more selective for areas of the body. So we have Astelin, which is considered a first generation, which is a nasal spray, olpatadine, which is often commonly found in different types of antihistamine eye drop and nasal spray formulations, and ketoprofen, which is an eye drop as well. Within our second generation category, we have fexofenadine and levocitrine. And these can come in various dosage forms, such as tablets and suspensions or tablets and solutions. And then around the world, we have other second generation antihistamines that both come as a branded type of product, which would require a prescription, versus those that would be considered an over-the-counter product, which a patient then could go into a grocery store or a local dispensary or pharmacy and pick up the products without a prescription. So some of our other medications that we have is the loratadine, desloratadine, and cetirizine. And so exactly how do our antihistamines work? So antihistamines work by attaching to the histamine 1 or H1 receptors on immune cells. Commonly we find these on mast cells is the very common place that we find these receptors, as well as other formed elements within the immune system. And it blocks them from being stimulated by histamine. So you can kind of see in this word, when you think about an antihistamine, it's against, anti, right? When you go back to some of your basic words, histamine. And this just kind of shows you that diagram so that when a person is experiencing an allergic type of response, whether it be like allergic rhinitis, that allergen comes in with that preformed mediated, typically IgE antibody, or excuse me, the IgE immunoglobulin. And so in this case, you can see then that once that antigen binds to the immunoglobulin, it releases that histamine, and then that's what relates to the patient's symptoms. And so this could be the itchy eyes, it can be the runny nose, it can be the sneezing, it can be even the itchiness of the skin.